HAL has state-of-the-art total control blinking eyes with photosensitive pupils. The dilation state of the pupils, the blinking rate, pupil diameter, and reaction time are easily manipulated from the tablet PC, giving the user total control. The reactivity of each pupil can be disabled individually to simulate a head trauma. HAL cyanosis feature allows the user to control the color of HAL's skin when hypoxic events occur. Users can perform head tilt, chin lift, and jaw thrust. HAL's realistic airway can be intubated both nasally and orally using LMA or endotracheal tubes. Increased difficulty of intubation by turning on pharyngeal swelling, laryngospasm, and tongue edema. Sensors detect depth of intubation. Should the tube be inserted too deep, the left lung is automatically disabled, demonstrating right mainstem intubation. Correcting the tube position enables the left lung. There is a visible and audible gastric inflation with esophageal intubation or upon forceful bag valve mask ventilation. Ventilations are measured and logged, showing the instructor exactly how students are performing. HAL comes with 5 disposable realistic surgical tracheas for performing tracheostomy or needle cricothyrotomy exercises. Remember to replace the built-in trachea for one of the disposable tracheas before doing any tracheal surgical procedures. For demonstration purposes, a tracheostomy tube will be surgically placed into the trachea. HAL has multiple upper airway sounds synchronized with his breathing. HAL also comes with streaming audio, allowing the instructor to simulate the patient's voice and listen to the caregiver's conversation wirelessly at distances up to 50 meters. This feature allows users to create and store vocal responses in any language or select from a pre-recorded vocal menu.
Hello, my name is HAL.
Providers can easily control rate and depth of respiration and observe chest rise. Choose independent left, right, upper and lower lung sounds, which are synchronized with selectable breathing patterns. The sounds can be auscultated anteriorly or posteriorly. Multiple sounds are available. HAL features bilateral chest drain sites at the 5th intercostal space to simulate therapy for pneumo or hemothorax. Alternatively, one could utilize the needle decompression site to relieve a pneumothorax. Either lung can be disabled at any time to simulate a collapsed lung. Proper intubation is extremely important for adequate lung ventilation. This simulator is equipped with the ability to exhale carbon dioxide with each breathing cycle. This will allow providers to use colorimetric devices like the EasyCap 2 CO2 detector, providing visual feedback about proper placement of an endotracheal tube. Enable this feature by mounting a replaceable cartridge of CO2 on HAL's lower right leg. The instructor can then adjust the level of exhale CO2 through the software. HAL accommodates assisted ventilation, including BVM and mechanical support.
My name is Rod McDonald with Gomard Scientific. I've worked in adult critical care and anesthesia ventilation for 28 years. I'm here today to show you the dynamic lung model on the 3201. What we've made is a compartmentalized lung, not springs and bellows, which results in very accurate, realistic waveforms on the ventilator in both resistance and compliance settings. Probably the first thing to note is that the dynamic lung model is completely contained within the chest of the 3201, not a piece of adjunctive equipment within the ventilator circuit. Now I'll give an overview of the different features and capabilities of the dynamic lung model on the HAL 3201. HAL has variable resistance and compliance settings. With the resistance settings, we have 10 different levels of unilateral or bilateral resistance. The resistance can be set from a normal level, which he is on now, to a very tight, very stiff system that will result in airway obstruction. Also, on the unilateral setting, HAL's chest rise is delayed, making for excellent observation of airway resistance problems. One of the strongest features on the 3201 is the fact that it holds PEEP and maintains PEEP from 0 PEEP right up to 20 centimeters of water. We'll adjust the PEEP to 5 centimeters of water. Notice that the 3201 system holds PEEP, as we can see reflected on the respiratory graphics, as well as the very realistic resultant peak inflation pressure within a few centimeters of water. I'll increase the PEEP to 15 centimeters of water. Notice the resultant increase in PEEP, as well as the resultant increase in peak inflation pressures within a few centimeters of water. The 3201 maintains the PEEP to peak pressure relationship throughout all PEEP levels. HAL's lung compliance, as mentioned, can be set from normal to very stiff or very loose. We presently see HAL on a setting of PEEP of 5, peak pressures of 20, with a set tidal volume and assist control mode of 550. Now, if we make the compliance very low or make the system very stiff, we'll notice an increasing in the relative parameters, a peak pressure of 31, 33. All this is being done while the mannequin is still operating in full scenario mode. Now, if we make the lung looser or increase the numeric compliance value, once again, while the mannequin is fully operational, maintaining complete realism while HAL is ventilating above his set PEEP level. We see a return to lower peak pressures and very realistic respiratory graphics. As mentioned, HAL has 10 variable resistance settings. Right now, we have HAL in a unilateral resistance, and you could notice on the graphics that we have some very mild delay in expiratory flow. Exactly what you would expect with that level. Now, if we go to a more extreme situation with moderate resistance on both sides, we'll notice the very realistic delay in expiratory flow rates. Once again, very important to remember, this can all be done while the mannequin is running, demonstrating worsening situations, making for very excellent scenarios.
HAL has several realistic heart sounds which are tied to a user-defined heart rate and selectable rhythms. HAL is equipped with 10 conductive sites to allow the use of a real 12-lead ECG monitor. View ECG rhythms for each of the 12 leads. This feature permits the user to track cardiac rhythms and events with their own equipment, just like with a human patient. The instructor can select from the extensive built-in library of cardiac rhythms or create their own using two user-friendly options: the 12-lead ECG designer or the integrated MI module to specify occlusions, ischemia, or necrosis. It also includes two anteriorly conductive sites for defibrillator pads or a real pacer. To add to this realism, HAL can be shocked with real energy for cardioversion and defibrillation drills. An AED will display HAL's ECG, analyze his cardiac rhythm, and advise action, a perfect addition to competency-based programs. Chest compressions are measured and logged, showing the instructor exactly how students are performing. A full CPR sequence can be done with HAL, and the providers will automatically be evaluated on different aspects of the compression and ventilations, such as rates, strengths, and ratios. Bilateral carotid, brachial, radial, femoral, popliteal, and pedal pulses operate continuously synchronized with ECG. Pulse strength varies with HAL's blood pressure, and distal pulses can be disabled to simulate severe hypotension. Programmable blood pressure can be read using a real sphygmomanometer, and providers can auscultate the Korotkov sound. HAL also features a pulse oximetry sensor within the forefinger of the left hand. This allows providers to attach commercially available pulse oximetry devices. The lower right leg has an intraosseous site used for the infusion of fluids, blood, and/or drugs directly into the bone marrow of the tibia. It is a quick way to find venous access when alternate peripheral veins are not visible or palpable. HAL has a drug recognition module located on the lower right arm. The left arm can also be used to practice IV procedures, but it will not be recognized by the drug recognition module. The drug recognition feature can be used on the veins located on the interior region of the forearm and the posterior side of the hand. In order to start using the drug recognition feature, the system must be purged with clean water. This is done using the following procedure. First, make sure the simulator is turned on, and then attach the drain hose to the black port. Next, attach a syringe pre-filled with clean water to the white port. Once connected, purge the system until fluids can be seen flowing through the drainage hose. Now that the system has been purged, the drug recognition feature is ready to use. Each HAL is shipped with a package of syringes. Every syringe has a unique RFID tag. Using the Giga software, each of these syringes has to be programmed with a specific medication name and a corresponding concentration. This is done in the following way. Connect to HAL using the Giga software and then touch Setup, set MedID, and select one of the drugs in the drop-down menu. As an example, I chose epinephrine and assign a concentration, 1 milligram per milliliter. Now, place the syringe perpendicular to the forearm, wait for the syringe identifier to show ready, and click Add. A list will appear on the window showing all programmed medications. As of now, only one syringe is programmed in. The drug recognition feature can be used with either IV push or IV infusion. If the provider selects the IV push method, it is important to note that the system is accurate up to a volume of 50 milliliters. If more volume is required, the drainage hose must be connected to the black port to maintain accuracy. When using the system for IV infusion, GOMARD strongly recommends that the drainage hose be connected. As the drug is delivered, the software will detect which drug is being given and will calculate the dosage administered. The software can either be set to auto mode, where the drug is applied directly into the model, or it can be set to prompt the instructor, who decides whether the drug gets administered or not. The drug recognition feature can be used at any time during a simulation, or it can be integrated into a branched scenario. For example, in a branching scenario that starts out with clinically significant bradycardia and no action is taken, HAL will progress to ventricular fibrillation. But if 1 milligram of epinephrine is given, HAL will skip to the next node, and the physiologic model will change HAL's vital signs as appropriate. When a session is complete, we recommend that you flush the system with an alcohol solution, making sure to connect the drainage hose to the black port and the syringe containing the alcohol solution to the white port during the flushing procedure. Note, to simulate a patient with no accessible peripheral IV sites, connect only the syringe. Pull the plunger to create suction, which will collapse the veins. Disconnect the syringe tube from the arm port while maintaining suction. The port will seal and the veins will remain collapsed. In addition, HAL has IM sights on both his deltoids and quadriceps. HAL has a seizures mechanism that can be used in conjunction with scenarios. The severity of the seizures can be programmed with a touch of the stylus. There are 2 different intensities to choose from. HAL has multiple bowel sounds on the 4 quadrants of his lower torso. Each quadrant can be adjusted to a different audio level or turned off if desired. HAL can be catheterized via exchangeable male and female genitalia. For additional realism, virtual vital signs monitors are available in both fixed and mobile formats. The S3201 comes standard with a fixed monitor. The vital signs monitor is controlled wirelessly through the tablet PC. Use selected configuration or create your own configuration to mimic the real monitors used in your facility. Customize alarms and share images such as ultrasounds, CT scans, lab results, and more. Display up to 12 numeric parameters. And select up to 12 dynamic waveforms. As an option, the simulation experience can be enhanced with the use of our Pro Plus recording and debriefing system. GoMart has integrated the Giga software with Sim Console to create the Pro Plus system, which will allow the user to easily control both simulation and recording simultaneously using one PC. The Pro Plus comes standard with a pan-tilt-zoom USB camera and 2 Wi-Fi cameras. The system will allow the user to record up to 8 video and audio streams, 4 patient monitors, and multiple log files. HAL can be equipped with either an automated bleeding trauma arm or bleeding leg. Attaching the trauma leg or arm is simple using GoMart's Quick Connect Trauma Kit fittings. Both trauma arm and leg feature realistic arterial bleeding that is pulse and blood pressure dependent. Blood flow can be stemmed with the use of a tourniquet.